September 28 is World Rabies Day. The theme for 2021 is Rabies, Facts, Not Fear. So, what is rabies? Rabies is a preventable viral disease most often transmitted through the bite of a rabid animal. The rabies virus infects the central nervous system of mammals, ultimately causing disease in the brain and death. Rabies is a disease of terrestrial and airborne mammals, including dogs, wolves, foxes, cats, lions, mongooses, bats, monkeys, and humans. The first symptoms of rabies can appear from a few days to more than a year after the bite happens. At first, there's a tingling, prickling, or itching feeling around the bite area. A person also might have flu-like symptoms such as fever, headache, muscle aches, loss of appetite, nausea, and tiredness. After a few days, neurological symptoms develop, including irritability or aggressiveness, excessive movements or agitation, confusion, strange thoughts, muscle spasm and unusual postures, weakness or paralysis, extreme sensitivity to bright light, sounds, or touch. Someone with rabies can produce a lot of saliva and muscle spasm in their throat, might make it hard to swallow. This causes the foaming at the mouth effect that has long been associated with rabies infection. Also, person may have fear of water, air, light, another well-known sign of rabies. Rabies virus is transmitted through direct contact, such as through broken skin or mucous membranes in the eyes, nose, or mouth with saliva or brain or nervous system tissue from an infected animal. People usually get rabies from the bite of a rabid animal. Other types of contact, such as petting a rabid animal or contact with the blood, urine, or feces of a rabid animal, are not associated with risk for infection and are not considered to be exposures of concern for rabies. Rabies virus becomes non-infectious when it dries out and when it is exposed to sunlight. Different environmental conditions affect the rate at which the virus becomes inactive, but in general, if the material containing the virus is dry, the virus can be considered non-infectious. Types of rabies: paralytic 30% and furious 70% of total infection. Clinically, it has two forms: furious rabies, characterized by hyperactivity and hallucinations; paralytic rabies, characterized by paralysis and coma. Infection spreads from muscle fibers into the peripheral nervous system, traveling to the central nervous system. Infection of the central nervous system can lead to encephalitis, furious rabies, or acute flaccid paralysis, paralytic rabies. Treatment relies heavily on the time of exposure. Paralytic rabies is characterized by delayed viral neuroinvasion and a more intense inflammation than furious rabies. Around the world, rabies kills more than 59,000 people every year, mostly by dog bite. The most affected countries are in Africa and Asia, and almost half of the victims are children under the age of 15. The good news is that rabies can be prevented through vaccination of both animals and people. Methods to cure. Once a rabies infection is established, there is no effective treatment. Though a small number of people have survived rabies, the disease usually causes death. If you have been bitten by an animal that is known to have rabies, you will receive a series of shots to prevent the rabies virus from infecting you. Rabies shots include a fast-acting shot, rabies immunoglobulin, to prevent the virus from infecting you. This is given if you haven't had the rabies vaccine. This injection is given near the area where the animal bit you, if possible, as soon as possible after the bite. A series of rabies vaccinations to help your body learn to identify and fight the rabies virus. Rabies vaccinations are given as injections in your arm. If you haven't previously had the rabies vaccines, you'll receive 4 injections over 14 days. If you have had the rabies vaccine, you'll have 2 injections over the first 3 days. Vaccination of dogs and human beings. Rabies is a vaccine-preventable disease. Vaccinating dogs is the most cost-effective strategy for preventing rabies in people. Dog vaccination reduces deaths attributable to dog-related rabies. Rabies vaccines may be used safely by all age groups. About 35 to 45% of people develop a brief period of redness and pain at the injection site, and 5 to 15% of people may experience fever, headaches, or nausea. After exposure to rabies, there is no contradiction to its use because the untreated virus is overwhelmingly fatal. Rabies has the highest mortality rate, 99.9% of any disease on earth. If it's not treated before symptoms appear, it's deadly. Asia, 31,000. India, 20,000. China, 4,000. Deaths. Worldwide, India has the highest rate of human rabies in the world, primarily due to stray dogs. Vietnam and Thailand are having prevalence of rabies. Africa, about 24,000. Till 2021, there were only 4 cases of rabies in Canada since 2000. 9 deaths from rabies were reported in Germany between 1981 and 2005. Australia is free of rabies. There have been 2 confirmed human deaths from the disease in 1987 and 1990. Indian Government Initiative. National Rabies Control Program, Ministry of Health and Family Welfare, Government of India. The strategies for the human component are training of health professionals, implementing use of intradermal route of inoculation of cell culture vaccines, strengthening surveillance of human rabies, information, education and communication, laboratory strengthening. The strategies for the animal component are population survey of dogs, mass vaccination of dogs, dog population management. Goa Government Initiative through Mission Rabies. Approach 1. Catch, vaccinate, release. This is carried out by a highly trained dog catchers who use nets to catch free-roaming dogs safely before vaccinating and releasing them. Approach 2. Door-to-door delivery. This is when our team goes door-to-door asking households if they have pets and offering them a free rabies vaccination. Approach 3. Static point project. This is where central locations are chosen and temporary vaccination clinics are set up, allowing pet owners to bring their animals to be vaccinated. Surveillance team remains poised to respond to any suspected animal emergencies. They rescued 38 animals in need, the majority of which were suffering from open and infected wounds or had been involved in road traffic accidents.